parents are confused about whether we are playing or whether we're actually doing therapy. So a part of any trauma treatment is always providing psychoeducation. You gotta not only tell them about, not only for the child, but for the adult, because the children don't know why do they have nightmares all the time. Why is it that they're jumpy, they're getting easily startled? Why is it they're angry? They're always not only angry, but anxious, more than their usual. So psychoeducation normalizes behaviors, normalizes the symptoms that come with PTSD, not only for the children so they know they're normal, they just have been through an ordeal, but to the parents to recognize when their child is showing the symptoms of PTSD. And sometimes it may not reach the level of PTSD, but it's still pretty unsettling for the child. So we do a lot of psychoeducation, not only about the trauma, but also the therapy and how the therapy proceeds. So generally in any kind of trauma treatment, we start with some psychoeducation about the trauma, the type of trauma, and the different models of the treatment. And then we explain how the treatment works. So even though I am using play, for instance, if I'm using sand, and a lot of times I also have the parents sit in the sessions. So as the parent is sitting, I tell the child, I give them one of the baskets that are here, and I ask them to go around and then pick figures they wish to make a picture of the scary thing that happened. And then they make the picture in sand. And as they make the picture, then there is a number of things I identify. For instance, if I'm using EMDR with a child, which I have used with many children with autism, I can identify the negative cognition that goes with that image, the positive cognition they want to have once they are done with the therapy, the feelings that come up, how disturbing the whole thing is, where in their body they experience it, because we also mix some somatic therapy with a lot of therapy models. So the parent is sitting there the whole time. Even if the parent is not sitting, usually I take pictures. And then I explain how I use the sand and the figures in order to do the EMDR processing, or to do TFCBT.